heart of Ndhiwa constituency, Homa Bay County, a ray of hope washed over the community as a medical camp, a beacon of health and healing, had arrived. The air was filled with the hum of activity as doctors, nurses and volunteers worked tirelessly to provide essential medical care to Ndhiwa community residents battling different types of health complications. The camp has also provided essential services to empower women and promote their well-being. Gynecologists, midwives, and other healthcare professionals offered consultations, screening, and family planning advice, enabling women to take control of their health and make informed decisions in the future. During this year's annual camp, the pediatric care specialists focused on safeguarding the health of the youngest members of the community, where they worked tirelessly to diagnose and treat a wide range of childhood ailments, ensuring that every child received the care they deserved.
Ibiro neno kochamo omena. Omena en chiemo makelo ne rateke mag del. Mijingo.
Na hiyo omena haifanyi sukari pande juu ama it does not haikuwa converted into blood sugars.
Omena ok mi sukari dhie dendi.
Nikasema nimekula usuga ama spinach ama terere ama inaitwa nini? Hizo mboga green vegetables saga, the green leafy vegetable.
I'm Benny Samuel from Mediterranean Hospital, and we are located at Olare in Homa Bay. Currently, we are participating in this Ndhiwa medical camp. This is organized every year. Last year, we participated. There were about 2,000 people coming for the camp last year. And we focused primarily on areas like hypertension, diabetology, cardiology, and neurology. There are many clients or patients around this place where their ailment is not diagnosed. We have seen even people with 50, 70 years old who have come in for first time diabetology or hypertension treatment, or they haven't even checked their hypertension in the last 60 years. So we were able to pick up many such cases, and that is something which needs to be addressed by the society. There are many people who lives with a lot of hypertension, diabetology and cardiology issues. So Our motive of participating in this camp was to pick up those cases and provide the treatment as required. And that's what we have been doing this year also. Hypertension and diabetology. Hypertension and diabetology are like families. Most of them will have similar symptoms.
Hello team, my name is Dr. Godfrey Kiprotich-Bet. I am a medical officer working with Moi Teaching and Referral Hospital. This is, so I am speaking on behalf of the hospital with the permission of our CEO. This is our 7th time doing this medical camp here in Ndhiwa. It's part of our CSR policy as a hospital. I would like first to applaud our CEO, our able CEO, Dr. Philip Kirwa, in collaboration with the MP of the area, Honorable Martin Zowino. This is a very noble venture. And being in charge of the clinical team that has been here, we can actually attest to it even as the camp comes to an end today, this being day 2. So as a team, we have come here with several teams. So we are with several teams. So we have subspecialties. We have the general medical team, we have the pediatrics team, we have the ENT team, we have the dental team, we have even a gyna team, we even have a psychological counseling team, because as you are aware, as per the WHO's definition of health, there is no health without mental health. So we have all those teams, including the biomedical engineers, who are helping us with the instruments.
Kana winjo kamano chunya no bedo mamor, kana biro notimna gimoro amora e thieth kanyo, mae bang'e nokona ni Nakuru chieng' tarik chieng' tich. To nitiere gari mabiro kawowa matero wafisi jolos oganda jo Nyasaye nobedona maber. Kana wabiro ka chieng' manitero wafisi notera Kisii. Kendo dakteche nokawo ting' maber kabisa, kendo ne gitiyo yo makare. Ne gimaka ka gitera kar thieth, mana yudo thieth maonge gimoro amora manachulo, ma kendo gichak giduoga Ndhiwa kama ne gikawa. Omiyo naduoko negi erokamano mang'eny. Ka koro gigi sani wang'a konchiel mane giloso nino, kendo anyalo chako wuoth madhi ka.
For Kisii Hospital, I am happy to participate in this medical camp. I have previously participated in similar camps, medical camps that have been held here in Ndhiwa, and every time we are having medical camps, it's getting better and better. Yesterday we saw quite a number of patients. I think even there are many than the previous camps. We saw 500 or so OPD and advised 53 patients for cataract surgeries. The interesting part is that we saw patients who were in the previous camp who came with positive results. They were happy because they had surgery the other
iluonga ni Jojo Kothobari, mong'ere gi nying mar Ondhola Bigo. Awa e dhot mar Kumungu sub location, Ndhiwa sub county. An aduoko erokamano ne African Foundation koriwore gi Mheshimiwa Martin Peters Owino. Waduoko erokamano kuom thieth magikelo Ndhiwa, thieth manono. Jomong'ol oyudo wheelchairs, oyudo gige wuoth, joma tuo tuoche mang'eny magalagala be ithiedho nono. An mano kwayo mamedo lamo ne Nyasache bong' nyakalaga ne wuod ruoth ka gimedore gi migawo mar African Foundation. Erokamano.
In this. They're numerous. I think somebody else will talk about that. But as National Syndemic Diseases Control Council, we are on board because of the syndemic diseases that are associated with particularly this area. HIV, for instance, remains a problem, even though for Homa Bay County we've managed to bring down the prevalence rates to just above 13%.
Higa mokadho ne abedo gi tuo chandruok mar tuo mar wang'. Kendo tuo mar wang' no nomiyo abedo gi dwaro mondo ayud kaka anyalo neno. Ne ok anen, wengena duto ne ok nen maber. To kane wabiro Ndhiwa Primary School kaka ne wood chief okelo thieth, ne githiedha maber kendo notera Kisii modhi otimna operation mar wang'. Kendo nayudo ka aneno koro maber nyaka sani. Gima koro chanda sani en mana adwaro reading glass kata kiyo mar somo, makasomo to magnifying andiko. Mane e chandruok ma koro an go. To neno ta onge pesa manokwaya, ne wood chief manochulo thiedho te.
My name is Stephen Oyugi. I work with the National Syndemic Diseases Control Council. That is the state corporation tasked with the coordination of the HIV response in the country. I am the regional HIV coordinator overseeing Homa Bay and Migori counties. Now, today we are at Ndhiwa Primary School, where we are holding the second session of Ndhiwa Be Healthy Medical Camp. This is basically community focused because it's offering medical services to the community with a huge catchment area. That is the Ndhiwa sub-county, definitely with gaps in health service delivery, just like every other sub-county in Kenya. So this comes as a blessing because, as we all know, medical services is not one of the cheap services to be provided, and therefore gaps will definitely exist. As we're here today, we are offering an array of health services ranging from primary health. Basically, we are offering testing, diagnosis, and screening, and as well as referrals. Cases that cannot be handled from here are referred to higher level facilities. Now, in terms of partnership to make this a success, a number of entities are involved in this. They are numerous. I think somebody else will talk about that. But as National Syndemic Diseases Control Council, we are on board because of the syndemic diseases that are associated with particularly this area. HIV, for instance, remains a problem, even though for Homa Bay County we've managed to bring down the prevalence rates to just above 13% compared to the national levels, and comparing to where we're coming from when we had prevalences that were as high as over 20% among certain geographical areas and subpopulations. So this remains a problem, and therefore today we are offering HIV services as one of the items in the menu that the community, the Ndhiwa sub-county community, are accessing today.
From National Cancer Institute of Kenya, I'm the head of Partnership and Resource Mobilization. Today we are happy to be here on invitation of Honorable Martin Owino, who came and approached us, National Cancer Institute, to partner with them in this medical camp. And I'll say briefly about National Cancer Institute of Kenya. It is a semi-autonomous government agency which was formed under state of cooperation. It was also established under an Act of Parliament, which is Prevention and Control Act number 12 of 2015. One of our mandates, major mandate for National Cancer Institute is prevention and control. And also what we do as National Cancer Institute of Kenya is that we advise the Cabinet Secretary on matters cancer prevention and control. Other objectives of National Cancer Institute of Kenya in relation to this medical camp is that we create awareness to patients out there. As we all know, cancer is one of the deadly diseases in the world, and in developed countries, actually it comes third position after infectious disease and cardiovascular diseases. In our country, Kenya, we are focusing on cancer because many people actually lack awareness on cancer. And as one of our mandates, when we came here on this medical camp from yesterday, we came with our team, and our team of awareness, cancer awareness, have done a good job. And we have seen from the response, we have seen high response. When we started, there was low response, but as per today, many people are willing to do the screening. The major cancer that we are concentrating on in this medical camp is we have cervical cancer, which is common in women. Then we also have breast cancer, and we have also prostate cancer. That's what we are doing here. As cervical cancer, we are focusing on people who are in productive age. And by this we mean any girl who is sexually active up to the age of around 50, 55 years, we are testing them. And we are encouraging that many ladies to go for this cancer screening. And also to prevent, we also urge many to go for HPV vaccine, which at least will also prevent these diseases. On the prostate cancer, we have realized that there was a low uptake on men, and we have realized that it's because of lack of awareness. But at least from yesterday up to now, we have done over 1,000 cancer awareness, and we have seen the impact of the results. The people are coming are many. So we urge that all people out there to go for screening. And when you screen and you find it, whether it's at the early stage, it's manageable, cancer is treatable when it's found at the early stage. We have also partnered with other partners because alone as National Cancer Institute of Kenya, we can't manage prevention and control. We do partnership with different institutions. Like in this medical camp, when we came with the resources to do the screening, but we have partnered with other institutions to carry out the services. Like we have our partners, Kenyatta National Hospital, who are doing cervical screening, and we have another partner, AstraZeneca, who have in fact donated the machines for prostate cancer. So we thank you very much for the Ndhiwa people, for the high turn-up, and we believe that when these things will be spread in other places, this disease called cancer will be manageable. Like our team, we are here, we have another team in Meru, another team in Kwale, and we'll make sure that we reach in all other areas, and we also want all other constituencies also to copy what Ndhiwa constituency is doing. For the Member of Parliament, what he has done today, he has impacted many lives. We also do trainings. We have done also the training of CHPs. For CHPs, our foot soldiers down there. Like here, we have trained from yesterday to today. We have trained around 100 CHPs, and there are ambassadors down there. And at least when they'll be going to different areas, even after we have left, they're going to spread the message about cancer. Thank you very much for the invite here, and we look to reach more other places. And as I've said, alone we wouldn't have managed. We had to partner with the other partners to use the resources we have to manage this cancer. And at this juncture, I'll invite one of the partners at least to give you the experience, because they're the ones who are dealing with the patients direct, to give at least what they have experienced with the patients here and the feedback. Thank you very much. I'll invite a partner from Kenyatta National Hospital.
Coordinator. We have only prevention, curative, palliative, so all the 5 facets are linked. Yes. If they will be helping this year, we had a theme, which is called health as well, promoting health as well, through partnerships. So we're broadening a number of partners to be able to support us around. Most of them, the MP will take you through these partners. As has already been alluded to, we have a big budget big disease burden in this subgroup. And that is why it is realized by the member of parliament that this becomes an annual that can serve as a place of diseases are rather prevented.
We started this about 7 years ago, and we've been doing with the MTRH in small numbers. Last year we did it a full day, and we found out that there are so many diseases that most of the people are working with and they didn't know. So we decided that we are supposed to do it for 2 days this time to be able to capture most of them. If you see the data, you'll find that Ndhiwa has the highest diseases. When you look at malaria, when you look at STD, when you look at child pregnancies, all those when they come together, and so many elderly have diabetes and they don't know, and we have cataracts, which we just remove one day, it's just a few hours, and the person is seen. So what we want to do in Ndhiwa, which is supported by our MP, is to make sure that we are able to catch diseases early, and we are able to prevent what is preventable.
My name is Silas Tarus. I'm a principal health administrator at Ndhiwa Hospital. I'm the team leader for this MTRH team. And first, I want to say that on behalf of our CEO, Dr. Kirwa, and on behalf of the team, the multidisciplinary team that we came with, I want to say that we are happy to be partnering with other partners in driving this agenda in Ndhiwa of health interventions. As you note that the theme of this camp is advancing health for wealth through partnership. We can only create wealth when we are healthy, and the best way to make sure that we are healthy is to promote interventions that really identifies conditions at an early stage, so that at MTRH, being a referral and teaching hospital, we not only wait for patients to come there, we also go to the community and identify these conditions at early stages.
My husband, who is the MP, Mr. Martin Owino, Ward Chief, and our 3 sons, Brian, Calvin, and David. So each one of us contribute to this African Health Foundation, and from there we are able to help the community. And this is we started when we were in Boston, and we thought that it was good to bring back and to give back to our community. There we found some friends and doctors and some nurses that helped us and joined with us. From there we became helping the community. So for 17 years we've been building homes for widows. We've been supporting public health initiatives, and most of all, we've been taking care of people to make sure that public health, which is primary care, is taken care of. Primary care is very important, so that we are not running after diseases, but we are catching them early or we are stopping them. And that is why we started African Health Foundation.
Can you put him also? Yeah.
people have got out to come and be checked. That means they value health. Most of people are walking sick and they don't know, especially those with diabetes, high blood pressure, cancers, they don't know. But we have come now to screen. The importance of this, which Professor said is our theme, advancing health for wealth through partnerships with many organizations. The importance of this is Ndhiwa moyuoro thieth masani ne wagoero kamano nikech ji mang'eny mawuotho gi tuoche to ging'eyo. Koro gima watimo kani en geng'o ji mondo kik bed gi tuoche modhi malo ahinya, koro gidhi Kenyatta, gidhi Moi, gidhi Jaramogi nikech tuo oseo piny ka. Instead wakelo jok mawachogo, jo Kenyatta ne ka, Jaramogi ne ka, jo Eldoret ne ka. Tiende ni wadwa ni wayud tuoche gi kapok ginya mondo wathiedh gi chon, ji obed gi ngufu ma ginyalo tiyogo e shamba kata ng'ama dhi tich. Nikech wayudo ni gima kelo dhier e ot ka ot moloyo en tuo. Kodonjo to deko kode, ng'ano dhi osiptal, seche modhi osiptal no nyaka ji dhi nene. Seche ma ji nene go, ok gidhi tich. Eventually kuom hayo marach ng'ano nyalo bedo notho. To en manyocha ochung' ne odno. Koro wakwayo, kendo akwayo ahinya joma chuo. Gima koro negowa mogik en gima iluongo ni prostate cancer mamako duong' ng'ato cha. Ka in gi higa 50 gi wiye, kok ibiro ka kawuono, bi kiny. Nitie Cancer Institute ne ka. Mano institute maduong' mar cancer matimo gima iluongo ni screening. Mondo ging'e, gipimo pima rembi. Mondo nyisi ni rembi ni nitiere cancer cells, intim kama. Joma mine bende kamano. Jok moko man gi TB, man gang'o, ma en field hospital, githiedho everything. Motamo gi e field ka, wabiro refer to MTRH, Moi, to Kenyatta. Moko bende waun gi private institution ka called Metrina, in bende gikonyowa. Koro gima duong' ni value your health, ni mondo ikaw ngimani matek. Kata onge gima rach, biya ka, kok ibiro kawuono bi kiny, opimi monyisi ni in ler. Kesa moro tuoche gi ringe remo, to ok ing'eyo ni gintiere. Mano emomiyo wan ka kawuono.